Here. Hi, everyone. I want to thank you for letting me be here today and appreciate your willingness to spend time with me. My name is Tiffany Tobler. I am a senior at NAU and their online dental hygiene program. I'm working towards my bachelor's degree, and this project is a group project for my senior capstone. I have been working in dental hygiene for 20 years, and we wanted to find a way to help veterans obtain better dental care in conjunction with good systemic health care. Before we get started, I have a quick questionnaire survey for you to fill out just to see your knowledge about oral care. You can pause the presentation, scan the QR code. So our project, like I said, is focused on veterans. In my time as a hygienist, I noticed a trend among my patients who had recently separated from the military. They often go a few years from the time they leave their military service until their next dental appointment. And usually what they're coming in for is sensitivity or pain. This is a time of transition in their life. They're moving away from a life where they're told when to get their medical and dental checkups. If they don't go in for their checkups, their account gets flagged. They're not eligible for promotions. They can't go on deployments. So going in for checkups is really important. But once they separate, they're relearning how to prioritize those kinds of things. Many times in the military, there is often the approach as well of just take two ibuprofen and walk it off. So that is also a change that they're having to deal with. The other members of my group are working with different veteran organizations to help educate our military members about the importance of seeking dental health care. And we also wanted to have an interprofessional aspect where we can help other members in the healthcare profession find ways to encourage our patients to seek dental care. So why am I here and not at the VA? Not every veteran has access to a VA clinic, on top of which the level of care they qualify for in the VA depends on a lot of criteria, like what level of mental or physical disabilities they have from their time in the military, how long they served, and what war or conflict they were involved in. Qualifying for dental care through the VA is even harder. You either need 100% disability or proof that your dental needs are service related. Of the veterans who qualify for medical care with the VA, only 15% qualify for dental care. Finding out if you qualify for care also requires a lot of paperwork and can be confusing or frustrating. The objectives of our project are to describe the link between oral health and systemic health, explain the benefits of preventive over emergency care, identify barriers that limit access to dental care for veterans, show ways to encourage patients to seek oral care, and recommend resources for local dental clinic options for our veterans and also everyone else. We performed a need assessment survey among 164 veterans. This included currently serving military members, retired veterans, and veterans who had served but did not retire from the military. Of those we surveyed who are former military but didn't retire from the military, only 52% have a regular dentist they see. And out of those former military members, only 66% have seen a dentist in the last year. This is important to note because only 17% of military members make it to retirement. If you retire from the military, you have options for dental insurance for life. While you are serving, you have options for dental insurance. There's a good chance that the veterans you will be interacting with will fall into the category of not having dental insurance through the military. This is why screening for dental care is so important. There's a good chance that many of the veterans will have some form of medical complication that will affect their oral health. There is a VA research team, and they found that diabetes affects 25% of the VA's patient population. It was also found that this was the leading cause of blindness, end-stage renal disease, and amputation among this population. So helping these veterans with their dental care will lead to a better quality of life. Also in this survey, we had many people comment about how frustrating it is to navigate the VA healthcare system. So what prevents our veterans from seeking dental care? It's actually very similar to everyone else. The cost, lack of motivation, fear, mental health, lack of transportation, distance to care, and lack of education on the benefits of dental care. So which is better, home care or a checkup? The answer is both. Home care gives you daily protection for your teeth and gums. Brushing twice daily and cleaning in between the teeth helps to minimize the risk of cavities and periodontal disease. Using a mouthwash and brushing your tongue are also important. But there are things that a regular checkup can offer that you can't get at home. Everyone develops plaque and calculus, and we're not talking about the mouth calculus. Calculus is the hard tartar that develops. It's the minerals in your saliva mixing with the food and bacteria and hardening on your teeth. Once it hardens, you need to see your dentist or dental hygienist to get that removed. Your dental checkup also includes oral cancer screenings, evaluation for cavity starting, looking at your gingival health, crunching and grinding, which could also be signs of breathing issues, smoking and tobacco cessation, evaluation for bad breath and what's causing it. There's also time for education on proper home care, changes in diet, and discussions about how your oral health and your body interact. We also take the time to educate expecting mothers on how oral health can influence the health of the baby. Your cleanings include more than you know. There are times when a checkup is not possible, and home care is extra important at these times. Patients with memory issues like Alzheimer's and dementia may hit a point where coming to the dental office is just too much for them. This is where home care takes over. Having caregivers who make sure that patients have good oral care will do a lot to help minimize pain and discomfort for them. When you go in for your dental cleanings, you probably hear them talk about periodontal pockets, periodontal disease, or you hear them taking the measurements calling out 323, 222, 323. What is that? Well, that is one of the tools we use to assess the health of your mouth. It can be a clue to what else is going on in the body. Any disease like diabetes or arthritis that cause inflammation also cause inflammation in the mouth. Your mouth can show a lot of red flags as to what's happening in your body. So if we look at this picture here on the slide, on the left side, we have a healthy tooth, gums, bone levels. That probe is going down 3 millimeters into the gums. The gums are pink and tight against the tooth. The gums are high, and the bone levels are also high. On the right side of the screen, we have what's called a periodontal pocket. It's a 5 millimeter pocket. You can see that the bone levels have dropped, the gum levels have dropped. The gums are also red and inflamed. And I also guarantee that if this was in a real mouth, there would be bleeding. We don't want any part of the body to bleed, including our mouth. Cleaning in between the teeth and under your gums is very important to help keep everything healthy. When we have bone loss, like we see on the right side of the screen, it can lead to the tooth being mobile, which can lead to losing teeth. We also don't want that extra inflammation. When the gums are inflamed like that, it makes them more permeable for bacteria to move across that barrier and get into the bone and start eating away at it. It also can travel to other parts of the body. I'm sure you've been told that diabetes can cause complication in the mouth. Hyperglycemia increases the number of bacteria associated with periodontal disease. These bacteria induce bone loss and cause inflammation. We know that diabetes causes inflammation in the body, and this includes the mouth. Everything that happens in the body happens in the oral cavity as well. Studies have found that individuals with type 2 diabetes are 2 times more likely to develop periodontal disease. I have a personal example of how fast diabetes can destroy the mouth in a short period of time. I have been given permission to share John's story, but of course I changed his name. John is an old school Marine. He is the life of a schedule. He has a routine and you don't change it. There are specific days for laundry, specific day to wash the sheets. Doctor's appointments are always on Tuesdays. He is the epitome of an old school military man. His home care has been amazing the entire time I've seen him, which has been over a decade. He brushes, he flosses. If I tell him to do something, he does it. He has 2 health issues. One is related to his eyes, which he uses eye drops for. The other is diabetes. He keeps his blood sugar under control, takes his medication, goes in for checkups. He follows the rules. If we look at this x-ray in that yellow circle, we're going to pay attention to his bone levels. They're a good, healthy level. Remember those measurements we were talking about? Always 2 to 3 millimeters with minimal bleeding. Most diabetics will still have some bleeding even with good home care. Unfortunately, his wife's health took a turn for the worst and he didn't come in for a year. During that time, he wasn't doing well with controlling his blood sugars or staying on top of his medications. His home care was still the same, but his stress levels were extremely high. In this x-ray, we can start to see some of the bone loss that was happening when he came in. On the left side of the screen, we have that original x-ray, but on the right side, we have a year later. If you look in that yellow circle, you can see we're starting to lose some of the bone around that tooth. At this appointment, those measurements were 6 to 7 millimeters. This is only one part of his mouth, but it was happening in his entire mouth. We were having bleeding everywhere too. At that appointment, we referred him to a specialist, a periodontist, to try and save everything that we could. He had an appointment with them before he left our office, and it was for 2 weeks later. Unfortunately, life happened, and it was another year before he got in to see the specialist. So now we're looking at 2 years. On the right side of the screen, you can see that dark halo all the way around the tooth. The tooth was now mobile, and it had 12 millimeter pockets. You'll also notice that the very last tooth is missing. The periodontist let us know that that tooth and many other teeth could not be saved. They did extract the teeth and put bone in to build it up. They were able to save the implant, but now he's going to have some dentures. At this point, he spent over $12,000 to try and put his mouth back into a healthy state. With diabetes being uncontrolled, it doesn't take long for that to destroy the mouth. Now think about how all that inflammation and destruction that was happening in his mouth was affecting the rest of his body and making it harder to control his blood sugars. Remember, it goes 2 ways. So what about your diet? It's not just about the sugar. A lot of times everyone talks about sugars and cavities, but we also need to talk about acid. Every time you take a sip of something that's not water, it changes the pH level in your mouth from being neutral to being acidic. It takes 30 minutes for your mouth to go back to being a neutral pH. That's 30 minutes of acid for every sip you take. So if you're sipping on a soda for 2 hours, that's 2.5 hours of acid attacking your teeth. Then if you want to add sugars on top of it, it's not a good combination. This is true of foods too. Citrus, tomatoes, they all cause an acidic environment. And it's not that you can't have these things, but it needs to be in a short period of time and you have to move on. Or make sure you're sipping water with every sip of other drinks. It doesn't neutralize the acid, but it does bring it down. My husband is in the Army and he tells me that on every deployment, in every common room, there's energy drinks and soda constantly available. It's how they make it through the long hours. So making sure that our patients are drinking lots of water is very important. I have another example of this as well. I have a patient that was coming in pretty regularly. He had a soda problem. We talked about it every time he came in. His answer to us was always that it wasn't going to change. We just needed to let it go. The important thing was he was coming in on a regular basis so we could catch the problems early and fix them. He had an insurance change and stopped coming to see our office. Unfortunately, he didn't go see any office. He came back 3 years later because he was having discomfort and he was embarrassed with how his teeth were. The x-ray on the left side of the screen was a good baseline, and the one on the right side was 3 years later. If we look at the yellow arrow in the bottom right, we can see the changes in the length of the roots. That green arrow on the top left, we've gone from having a good, strong, sturdy tooth to having the crown of the tooth completely eroded away, and all that's left are the root surfaces. That bottom left side where there's a red arrow, we can see we had a solid tooth, and now that big black shadow is a cavity. You can also see the dark circles on the teeth in the front. Those are cavities as well. And this is what his mouth looks like in person. Now, this all could have been minimized if he had been coming in on a regular basis and we were able to catch things when they were small. As a side note, this is also what the mouth will look like when someone has dry mouth or xerostomia from medications or chemo and radiation. You will see that the teeth are broken, they're brown. Those white areas along the gum line are decalcification. They're very soft and they're on the verge of becoming cavities as well. Now, when you look at this mouth, think about how much that's affecting his diet. Think about the foods he's probably choosing to eat. He's probably not having a lot of fruits and vegetables. It's probably going to be those soft carbs with a lot of sugar in them. Now, you might get patients coming in saying that they're there because their dentist told them to get a sleep study done. Why do dentists care? Well, according to a report from the 2021 Health of the Force, 9% of currently serving military members have a sleep disorder. This is not including all the veterans who are suffering from insomnia due to bad dreams, trauma, or pain. We know that sleep is very important to overall health. When you're coming in for your cleanings and your hygiene appointments, there's a lot of things that we notice that could be related to sleep issues. The first one is when we're doing the oral cancer screening, we look at that Mallampati score to see what kind of clearance we're getting back there. We also look for signs of clenching and grinding. Those moments when people are gasping for air, they slam their teeth together and they grind them around. We want to make sure everything's okay because if we put them into a night guard to protect their teeth, but they actually have sleep apnea, we can make things worse. Also, when our patients are lying back in the chair, we have plenty of time to observe their tongue. We get to see how it relaxes and falls back, and if it blocks that airway. You'd be surprised how often patients doze off while in their chair, and we can hear and see how they're breathing or if they're gasping for air. Now, I know that you're going to feel like you're already overwhelmed at work and you don't know how to fit one more thing into your schedule. So I have a couple of suggestions. When you're going over their health history, just ask when their last dental visit was. If you're asking about pain in their body, just make sure to ask if they're having pain in their mouth. If you find a patient hasn't been to the dentist in the last 6 months, encourage them to go. When you're discussing things like diabetes or heart disease, add a short discussion about how your oral health will affect those issues. When you're discussing nutrition or diet changes, ask if they're having pain in their mouth. If you're having pain in your mouth, it's going to change what you choose to eat. That's when you're going to reach for those soft, carby foods with sugars and fats. Also, when you're discussing energy drinks and how that affects the cardiac health, make sure to discuss how it can destroy the teeth. So this is just a quick screenshot of a resource I've attached that has the name and locations of different clinics throughout the state that offer discounted or free services. And these aren't just for veterans, they're for everyone. And these are the QR codes that you can scan to have those. Real quick, let's just review those questions from that pre-presentation assessment. So what are the signs of poor oral health? red bleeding gums, hot and cold sensitivity, biting on tenderness, brown areas that you see on the teeth. A person with poor oral health is at risk for all of those diseases listed: Alzheimer's, stroke, diabetes, cardiovascular disease, pneumonia, hepatitis, and pregnancy complications. You should seek dental care for all of these reasons. If you have not seen a dentist in a year, you have memory issues, tooth pain, periodontal disease, autoimmune diseases, or if you're pregnant. Real quick, I'll just go over the picture. Starting in the top left, we have a nice healthy mouth. The tissue's pink and firm and tight against the teeth. We don't see any redness or rounding of the gums, and the gum levels are nice and healthy. In the middle on the top, that yellow you're seeing is that calculus. You can see how red and swollen the gums are. This is early stages of periodontal disease. Now on the top right, we see advanced stages of periodontal disease. We have exposed root surfaces. That brown that you're seeing is the calculus, and you can see how rolled or bulbous the gums are. On the bottom left side of the screen is an example of caries or cavities throughout the entire mouth. That's what those brown areas are along the gum lines there. And in the middle, you have an example of dry mouth or xerostomia. There are cavities and exposed root surfaces as well, but the tissue has no saliva on it whatsoever. That dry mouth increases your chances of cavities. And on the bottom right, we have an example of an abscess. Those bubbles on the gums is an infection from the roots of the teeth trying to find a way to escape the body. Go ahead and pause the video and take a post-presentation assessment for me. I just want to thank you for letting me be here, and I hope that this has been very helpful for you. I'm going to just scan forward so you can see my references